And welcome to Endocrine Talk with Dr. Kabir. And I'm Dr. Muhammad Ahmedul Kabir. I'm a consultant endocrinologist and an assistant professor as well. And today's topic is very much common question in today's diabetes and weight management clinics. Actually, we have all heard about sugar-free is better, right? You grab that idea soda, that sugar-free snack, thinking you are doing your body a favor, right? But what if those sweet alternatives are actually tricking your brain, making you more hungry instead? Stick around because a recent report suggests sweeteners might not be as metabolically neutral as we thought, and it has big implication for our diet and health as well. Today, I would like to discuss a topic that is, do artificial sweeteners reduce calorie intake or do they actually increase sugar or hunger? Let's explore recent findings and clinical implications. A recent study that was published last January 2000 in this year in Nature Metabolism, they looked at how sucralose, a common artificial sweetener as we all know, affects the brain. In this study, using the functional MRI MRI scans, they found that in people with obesity, sucralose activated the hypothalamus and reward centers, that is potentially leading to increased hunger. So it's not just about calories, it's about how our brain interprets sweeteners without the expected energy. That is, I repeat, it is all about our brain interprets sweetness without the expected energy. So let's see who is affected most in this case. Patients with obesity had a much stronger brain response than those of normal weight. This mismatch between sweet taste and lack of calories may confuse appetite regulation. In fact, as clinicians, this means we need to individualize our dietary advice more carefully. So, what should we recommend, or what should be the clinical recommendations? So, sweeteners can be useful for type 2 diabetes patients as a substitute for sugary beverages, but it should be short-term goals, preferably in diabetic patient over sugary drinks. And our goal should be to transition patient to water or to unsweetened beverages. As because the artificial sweeteners may reinforce sweet cravings and could lead to increased hunger and overeating, especially in insulin resistant patients. So we should recommend them water and unsweetened options for long-term goal basis. So we can conclude that sweeteners are not a one size fits for all solution actually. In obesity and metabolic syndrome, moderation is actually the key. Encourage a gradual reduction of overall sweetness exposure. Don't just switch from sugar to sweeteners. Use the opportunity to reset the palate. And we should educate patients on sustainable, healthy beverage choices. So thanks for watching today's episode of Endocrine Talk with me, that is Dr. Kabir. If you found this information helpful, please like, subscribe, and share with fellow clinicians and patients. Let me know in the comments how do you guide your patients about artificial sweeteners. Thank you all. Hopefully see you again in the next video with another topic. Thank you.